Before you start to capture your meaningful use data, there is some mandatory setup which must be defined both at an individual provider as well as at a clinic level. This will ensure that your compliance is captured and hence should be done prior to starting your reporting period. The setup is done under our settings configuration, and within our workflow column we are going to choose the option called MU settings. Now you see that it has defaulted to the provider tab, and we're just going to go ahead and choose Dr. Sheldon Cooper. Now the provider tab is, as it implies, provider specific. Going from top to bottom, we're going to go through the requirements that are specific to each provider. Now within the practice, if you have multiple providers, some of them could be in different stages of meaningful use. Some may not be participating in meaningful use at all. In that case, you would default this as stage none. Or for those just beginning and are in stage 1 or stage 2. The significance of choosing the proper stage is because each stage has its own requirements, and therefore you would ensure that the reports are capturing the data correctly for that specific stage and reporting period. Now the reporting period is also very critical. Now if you notice in the case here, it has defaulted both from and up to date to the current computer date. So I'm actually going to go ahead and change this. We're going to say that Dr. Cooper is going to be reporting from October 3rd through 12/31, the last quarter of the year. Now, of course, the reporting period will be based upon whether you are doing Medicare or Medicaid and whether it is your first year, your second year, and so on. For the year 2014, for instance, everybody has a 90-day reporting period, but whether it is your first or second year and whether or not you're doing Medicare or Medicaid, it could be any selected 90 days, or it would have to correspond to a fiscal year period. Now, the attestation date can be left blank for now, but it is important that as you near the end of your reporting period, or actually complete it, and do your attestation, to please enter the attestation date. And the reason for this is that there are some provisions on some of the measures that up until you actually file attestation, you can still get credit for being compliant. Therefore, for historical purposes, if an auditor were to come in, say 6 months after you completed your attestation, they would still be able to reflect the reporting data that you submitted, as long as you have recorded that date accurately. Now, the second section here for the provider requirement is measures. Notice that there are applicable core set and applicable menu set, and then the selected NQF measures. Now, for the first two categories, you are able at a provider level to define which measures you're reporting. Remember, many of the measures have exclusions available, and those exclusions may apply to you but not your colleague. So for instance, for Dr. Cooper's case, we have currently all 17 core set measures of stage 2 defined. But let's say he does not perform office visits, so he doesn't have to do the clinic summary. We can simply get rid of measure 8. That means on his dashboard, menu set or core set 8 will be grayed out and it will not capture that or show him as non-compliant. The same could be true of any of the other measures if he qualifies to exclude himself. On menu set measures, you are only responsible for reporting 3 of the 6. So if you are one that doesn't want to see the red thumbs down on your dashboards for measures that you are not reporting on, then you can get rid of those. So for instance, Dr. Cooper is not going to report syndromic data. He is going to do his electronic patient note, his radiology attachment, and his family history, but he does not have to do cancer submission or specialized registry. So by removing those numbers, those specific measures will not be tallied on his meaningful use dashboard, and he will be taking the exclusion during attestation. Now, this is not mandatory. You can leave these numbers defined. It will default to every measure for whatever stage you have defined yourself as up at the top. The benefit, again, however, is if it is a measure that you are excluding, then it will never have a green thumb up. It will always have a red thumb down unless you have removed it from this property. If you remove it from the property, it will show disabled, so there's no confusion when you're actually going in to do your attestation. Some folks will see the red thumb down and forget that they're excluding it, and then they panic because they think they're not compliant. So that is actually a convenience. Now the NQF will default to the 9 NQFs that you are currently certified for. If you have attended the Meaningful Use webinar, you're aware that there is a total of 66 clinical quality measures. The requirement of both stage 1 and stage 2 is that you report 9 of those. So this will show the 9 that you are subject to. These are not definable by you, however. They must be entered by the back-end team based on which ones are certified for your practice. Now, when we get to the vitals details section, at a provider level, depending on your specialty and/or your patient population, there are 3 different ways you can exempt yourself. One, for instance, if you do not qualify to exempt yourself from any vitals, then you would say none here, which is your default value. However, if you're able to exempt yourself from height and weight because it's not relevant in your practice, or blood pressure based on the provisions within that particular core set measure, then you can take the appropriate exclusion here, and that piece of that measure again would be disabled. So for instance, with regards to your vital signs, maybe you do have to report vitals, but you don't need to report all of them because of your specialty. Now, if you don't need to report vitals at all, you would remove the number up here on top. So we would just take away number 4, for instance, under stage 2. And then you don't need to worry about this section. But if it is something where you cannot exempt yourself entirely, but you are able to exempt yourself from one section, then that is what you would do at this level. We're going to, for instance, say that Dr. Cooper is not able to exempt him. As an internal medicine doctor, he needs to record all vital signs. Now, e-prescription, if you notice here, it does say at the end that it is stage 2 only. If you are setting up a physician for stage 1, this option will not even be enabled. It will be grayed out, so you cannot select it because controlled substance e-prescribing is not available for stage 1. It is available for stage 2, but it is optional. Now, the electronic prescription of controlled substances is supported in prognosis and by default is part of stage 2 e-prescribing core set measure. If you have chosen, however, to not implement the function, you do need to make sure you exempt yourself. Otherwise, they will be counted in your denominator, but they will not be in your numerator because you will not be able to e-prescribe them unless you have done the appropriate implementation. Now, these next 4 I'm going to take collectively. All 4 of these are basically the same type of measure, even though each one has a different measure number. Out of the 4 measures, immunization registry is the only one that is mandatory, but it is only mandatory for stage 2. As for all 4 of these exclusions, this is only when the provider does not perform the function. If, for instance, you're an ophthalmologist and you don't do immunizations, you would exempt yourself. Same thing with the syndromic, the cancer, and other. If, as a specialist, you do not need to perform those, you can exempt yourself here at the provider level. So that is taking care of the provider level settings. Again, most importantly, you must define for each physician in your office a testing for meaningful use, a stage, and a reporting period at a bare minimum. And then once you do your attestation, remember to enter the attestation date. If you do not define a stage and reporting period, it will not break prognosis. You will still be able to function in the EMR, but when you try to run your meaningful use dashboard, it will be gray. It will show up as nothing but a blank window with an error message that you need to define a stage and reporting period for that provider. Now moving to the clinic tab. This is now applicable for all of the providers in your practice. This is now at a clinic level, not a provider level. Across the top is with regards to your dashboard icons and report tracking. Meaningful use on means, do you want meaningful use to capture data? Do you want it to tally this information in the audit trail? By default, that will be selected on. Show dashboard is the dashboard at the top of the screen, this gauge up here. And then the encounter level dashboard is when you're on the encounter close screen and you get the little pop-up. Some folks don't like to see that at the encounter level, so you can disable it if you would like. That does not exempt you from having to comply with the measures. However, that simply causes the dashboard not to show. Now, the miscellaneous section is also important, but again, keep in mind this is at the clinic level. On our left-hand side, we have our height, weight, blood pressure, and smoking questions. These are elements that must be captured on your meaningful use report, and they are representative of the test codes on your templates. If you have customized your templates and created questions that are not these default system codes, you must come in here and define the code that matches the question that you have created in order to get credit. Very important on the smoking question, because especially with 2014 edition meaningful use, your smoking question has been modified from the 2011 edition, meaning it no longer accepts a yes/no answer, but it needs smoking status with an applicable SNOMED code underneath it. Now, the default question, as you see in this example, SH smoking, does have the appropriate SNOMED codes mapped. So if you were to create a custom element on your social history templates, even if you answer the questions on the template, unless you've also defined that code in this property, you still would not be getting credit. And furthermore, the question that you customize would also have to have the appropriate SNOMED codes mapped underneath. So it's very important that you have the codes that you use on your templates match what is defined here. Now, on the right-hand side, we have read-only because the encounter type setup is handled under the encounter type master, but this will let you know offhand if you need to go define those. For instance, in my training environment here, I've only got 2 encounter types defined as office visit, and I've only got 1 defined as seen by doctor with none exempt. Every encounter type that you use in your practice should exist in one of these 3 fields. So unless your database only has these 2 encounter types, then something's missing here. And you need to go under your encounter type setup, which we will see at the end of this video, to ensure that those encounter types are defined at the correct level of meaningful use. Now, as we scroll down here, we have our immunization and syndromic surveillance sections. That this is for those of you who are able to attest yes. On the provider tab is where the provider is able to exempt him or herself because they don't do immunizations. But for when immunizations are done in the practice, you have multiple opportunities to attest yes, even though you may not fully be in production yet. So you need to select here the appropriate reason why you will be attesting yes, so that if an auditor were to come in post-attestation and see that you attested yes, they want to ask you why, and then you would have to be able to prove why you fit into that criteria. So for instance, under immunizations, are you attesting yes because you have registered with the agency before the deadline? Have you registered your intent and you're still testing and validating? Have you registered your intent but you're waiting on the public health agency to invite you? Those are conditions that even though you're not in production, you're still able to attest yes to the measure. The fourth option is when you're actually live. If you do have an immunization registry interface in existence, then you would declare this option. Now the next one here you can skip for stage 2 because as you notice it says applicable for stage 1 only. And that would be if you need to perform a test. Maybe you're a new startup client and you need to get the ball rolling. So you need to have Prognosis submit a test file on your behalf to your state registry. Then you would choose this option. And a little bit later when I show you the Setup Required tab, you would request our engineering team to create that test file for you. But that is not applicable for stage 2. And then at a clinic level, maybe you could not take the provider level exemption for immunizations because you actually do them. However, you're not able to submit the data to a registry. So you're going to take an exclusion, but it is at a clinic level rather than at a provider level. So again, there's some fine lines there between whether you're taking an exemption at a personal level or at a clinic level. And if you're attesting yes to having the interface live, why are you attesting yes? And this applies to both immunization and syndromic surveillance data. And then finally, we have the Setup Required tab. Now, the Setup Required tab is informational and at the same time gives you an opportunity to request stuff that you may not have yet. So if you notice here in our setup, we have Patient Portal and it lets you know whether it's on or off. secure email messaging, on or off, lab result interface, immunization, generating the test file, again, that is for stage 1 only, and then drug formulary checking. When the status is off and it's a measure that is mandatory and you do not qualify to exempt yourself, you can come in here and select and ask the back end to turn it on for you. For instance, patient portal, both stage 1 and stage 2, is mandatory in 2014. If it says off, you are not ready to start meaningful use data capturing because that is a mandatory feature. So you would need to set this, come up here and enter your email, and then click the option that says send email. And when you do that, it is going to send an email to the Meaningful Use Engineering team. They will send a confirmation back to your email that you enter, acknowledging that they will start working on that for you. So now I'm going to go ahead and close out of the Meaningful Use Settings Master, and instead I'm now going to go into my Encounter Type Master. So the MU settings displays for you what the MU status is for each encounter, but to define it, you must go to Clinic Encounter Types. And every encounter type that you use must have at least one, possibly two, but never all three meaningful use designations, and it must have an applicable SNOMED code if it is not exempt from meaningful use. So as we see here in the case of our acupuncture in the upper right, we do not have it selected as an office visit. However, we do have it selected as a seen by eligible provider. Now, if you recall from the measures requirements, some of them are based upon unique patients seen by eligible provider. Others state office visit by eligible provider, or some of them may have both, office visit seen by eligible provider. So you want to make sure that you are truly analyzing the encounter types on the appointment level. Will a doctor see the patient? If it's a nurse visit, then you would not mark it as seen by eligible provider. For instance, if I go in here to my encounter type lookup and I choose nurse visit, it is flagged as an office visit because I will be billing it with an E&M code. But I do not flag it as seen by eligible provider because a doctor will not see the patient. In the example of an office visit, however, I have both of them selected because it will be billed with an E&M. Therefore, it must have a clinical summary provided as per the mandatory core set measure, but it is also seen by an eligible provider. Now notice if it is seen by doctor and office visit, it cannot also be exempt. So you cannot select all three. But in the case of, let's say, surgery or procedures, maybe you don't do those in-house, so you could flag those as exempt. And now finally, when we talk about SNOMED code, if I go back in here to office visit, for instance, down here at the bottom of our encounter type setup, we have our SNOMED lookup. So if we go ahead and choose our CPT HCPC and indicate the CPT code for our office visit, I'll just go ahead and put in 99201, the system is going to return to us the possible SNOMED codes. So we want to go ahead and choose whichever one is most appropriate. Now keep in mind, this requirement at the encounter type level to assign a SNOMED is with regards to clinical quality measures only. So it is not relevant for your core set measures or your menu set measures to have a SNOMED at the encounter level. But in the context of the NQF measures, it is a requirement in many scenarios. So you just want to go ahead and save it once you have assigned that SNOMED code.